Hi, my name is Lupita Jimenez, and my fourth project is on memory loss on dementia. Dementia describes a group of symptoms affecting memory, thinking, and social abilities severely enough to interfere with your daily life. Though dementia generally involves memory loss has a variety of causes. It isn't a specific disease, but several different diseases may cause dementia. Some symptoms or changes you may have: memory loss, which is usually noticed by a spouse or someone else; difficulty communicating or finding words; difficulty reasoning or problem solving; difficulty handling complex tasks; difficulty with planning and organizing; confusion and disorientation. Psychological changes: personality changes, depression, anxiety, inappropriate behavior, paranoia, agitation, hallucinations. When to see a doctor. See a doctor if you or a loved one has memory problems or other dementia symptoms. Some treatable medication conditions can cause dementia symptoms, so it is important to determine the underlying causes. Is it treatable? In the case of most progressive dementias include Alzheimer's disease, there is no cure and no treatment that slows or stops its progression, but there are drug treatments that may temporarily improve symptoms. Alzheimer's disease. Alzheimer's disease is an irreversible progressive brain disorder that slowly destroys memory and thinking skills and eventually the ability to carry out the simplest tasks. This is what a brain looks before and after being diagnosed with Alzheimer's. Drug treatment medication. Enhancing medication improves mental function, lowers blood pressure, and may balance mood. Age range dementia appears. It's most common in people over the age of 65, but it can also affect younger people. Early onset of the disease can begin when the people are in their age 30s, 40s, or 50s. With treatment and early diagnosis, you can slow the progression of the disease and maintain a mental function. Of nearly 48 million adults 65 or older, roughly 9% have dementia. How dementia causes death. A person in the late stage of dementia is at risk for a number of medical complications, like an infection of the urinary tract and pneumonia, an infection of the lungs. Difficulty in swallowing, eating, and drinking leads to weight loss, dehydration, and malnutrition. In the end, most people with late-stage dementia die of medical complications. Sepsis is potentially a life-threatening caused by infection, related to their underlying dementia. Types of dementia. Dementia can be split into two groups based on which part of the brain is affected. Cortical dementia happens because of problems in the cerebral cortex, the outer layer of the brain. They play a critical role in memory and language. People with these types of dementia usually have severe memory loss and can't remember words or understand language. Subcortical dementia happens because of problems in the part of the brain beneath the cortex. People with subcortical dementia tend to show changes in their speed of thinking and ability to start activities. Usually the people with subcortical dementia don't have forgetfulness and language problems. Tests used to diagnose dementia. Cognitive and neuropsychological tests. These tests are used to assess memory, problem solving, language skills, math skills, and other abilities to relate to mental functioning. There's also laboratory tests, brain scans, and genetic tests. Thank you for your time, and I hope you learned a little something new.